Hey folks, this is Dr. Singh. So I want to talk to you about certain things which is very important to me, and I think it's important for everybody. As you all know that I've recently been trained in preventing heart attack and stroke and vascular dementia. And as a part of that quest, I'm talking about atherosclerosis, which is number one underlying disease causing cardiovascular illnesses. Overall, in the world, the impact of the disease is massive. In 2007, there were 12 million deaths because of this disease, which in 2017 has gone up to 19 million. So you can just see the sheer impact of this disease. US spends about $315 billion on this disease as of today. As of 2030, that number is going to be 1.3 trillion. So that's a huge number. And also other morbidities and economic impacts which has on the family and the society is, I can't really begin to start. 1 in every 3rd death in US is because of the cardiovascular illness. And out of those, 150,000 is in less than 65 years of age. That is totally unacceptable. A lot of these things can be helped with. Just to give you some statistics, every 34 seconds somebody has a heart attack. Every minute somebody dies of a heart attack. Every 40 seconds somebody has a stroke. Every 4 minutes somebody dies of a stroke. So some of you may be thinking, okay, there are two aspects of vascular disease. What if I die in a stroke? What if I die in a heart attack? Well, that's one aspect of it. But I don't want to deal with the second aspect. When I wake up and I find out that somebody is changing my diaper and I don't even know that person. So that is what I'm talking about. There's a lot of morbidity and long-term effects of the disease. About 4 million people suffer from long-term disability every year because of these events. And all these, if I tell you, can be prevented. Why it is not prevented? It's like insanity. Like how Susan Porter said, stop the insanity. So that's what I want to talk about, because underlying cause for all these illnesses is atherosclerosis, which affects all the vasculature. Do you know that there's 60,000 miles of blood vessels in our body? It's a huge number, right? And half of that is arterial. And once that gets affected, it's affected all over the place. It's not that it will affect certain artery more than the other. When you have atherosclerosis somewhere, you'll have atherosclerosis somewhere else. So what is atherosclerosis? So our blood vessels are made of 3 layers. I'm going to go slightly technical on you right now. So first layer is called intima, second layer is called media, and the last layer is called adventitia. The most important layer is the intima, which is facing the inside of the blood vessel. And it's lined by a single cell, which is endothelial cells. And under the endothelial cells, there is subendothelial space, where a lot of action happens before the disease process starts. And endothelial is like a fortress. It doesn't let anything get into the blood vessel. But once it becomes dysfunctional, which is endothelial dysfunction, which can happen with oxidative stress, some infections, blood pressure, diabetes, underlying illnesses. But the ultimate point is that endothelial gets disrupted. As a result of that, the cells or material or pathogens which are not supposed to go inside the lumen, or they invade the endothelium, they get in, and as a result, our blood cells go after them and starts an inflammatory process. Subendothelial, which is under the endothelium, away from the lumen. And this process goes on, and as inflammation happens, what inflammation is the swelling. So as the swelling happens, more and more macrophages, which are the white blood cells, are recruited in the area and causes more thickening of that intimal layer. And that can be detected way early before even the atherosclerosis starts to happen. Now imagine there's an artery, there's a wall which is, say, about 0.7 millimeter thick, and we are able to measure it through the ultrasound even when it goes up to 0.9 millimeter. So even 0.2 millimeter, even 0.02 millimeter can be picked up by a special ultrasound. And that tells us that there's something going on with the artery. This is the point where you do something about it. Because once it is atherosclerotic, then you already have the disease. I'm talking about the pre-atherosclerosis stage, when there's a swelling in the artery. And that can be detected, and that's where the CIMT comes in, which stands for carotid intima media thickness, which is the thickness of the arterial wall. And this is a life-saving test. Just to give an example, I recently started to implement that test in our practice. We did 32 patients on that day, and 24 out of those 32 patients have some form of disease, which they don't know. So that can have a huge impact on future of the cardiovascular health, on the health of the individual, family, society, and country, and the world as a whole. So I definitely urge, depending on the risk factors, running in the family, or if somebody has risk factors for themselves, that undergo a CIMT testing and prevent that premature vascular health phenomena. Easily done. Let us stop the insanity. Thank you.